Welcome back to FAMWISE. In this lesson, we are going to be talking about how to avoid pregnancy naturally using the symptothermal method. This is one of the most exciting modules for me because it's the whole reason why this course even came to be, because I was struggling so much managing my own fertility, and that's when I came across the fertility awareness method, which absolutely changed my life. So if you're excited about how to manage your own fertility, let's get into it. So remember that the fertile window is the period of time where pregnancy can occur if intercourse is had. It's your opportunity to achieve pregnancy. It's that 6-day long window, which includes the day of ovulation itself and the 5 days prior. This is because sperm can live in cervical mucus up to 5 days, which you guys have heard before. Once ovulation has occurred and that egg has been released and it's no longer viable, the chance of pregnancy falls to about 0. So here's an example of the fertile window on a calendar. So you see that star there, that would be ovulation. So therefore, we have a chance of pregnancy the 5 days before that as well, because cervical mucus can keep sperm alive. And if you have intercourse on that first blue day, you could get pregnant at the star. Remember that we are not predicting ovulation. So we don't really know if ovulation is actually going to occur on the day with the star or not. So if we see any type of mucus, EL or ES, we need to deem that fertile and we need to use our precautions. So however you decided to manage your fertile window, you would take that action. So let's say that even though ovulation isn't happening until the day of the star, you could only get pregnant those 5 days before that. But when we were on those early EL days, we didn't know when it was going to occur. So we still needed to take action. And those days would still be fertile. So what days are actually fertile? This would include your fertile window, which is your POC to peak plus 3. It would include any day of either peak or non-peak mucus in pre-ovulatory phase, so your EL or ES and potentially yellow days. Any days of unusual bleeding or spotting would be fertile, and any day you feel unsure or you've missed an observation. And on the other side, which days would be infertile? So this would be some of your pre-ovulatory days. We'll get into the rules later. Your post-ovulatory days, once you've actually confirmed ovulation and you're past peak plus 3, LH plus 4, or 3 consecutive raised basal body temperatures. Is my period fertile or not? So can you get pregnant on your period? And the answer is maybe. So a true period is always following ovulation. Your days of moderate and heavy bleeding, which would be like the 12 to 14 days after ovulation, are not fertile because hormones are too low to trigger ovulation. But it is possible to have mucus on light or very light days of bleeding. So these days are possibly fertile, as ovulation might occur early in the cycle. And remember that whenever we have cervical mucus, if there is sperm present, it can keep it alive for up to 5 days. So therefore, you must check for mucus on light and very light days of your period to clarify. If you do see mucus during your period, then it is fertile. You need to call it as you see it. So here's an example of a short cycle where it could be possible to get pregnant while you're on your period. So for this cycle, they have a heavy day of bleeding, a medium day, a light day, and then a light day of bleeding. And then they actually notice ES mucus on the very last day of their light day. And then they have more ES mucus continuing. So if they were to have sex on that last day of light bleeding, it is possible to get pregnant if they were to ovulate within that 5 days that the cervical mucus could keep sperm alive. So remember that we ovulate once per cycle, and this is the only time that we are fertile, the day of ovulation and the 5 days preceding this. So biomarkers and our charting identify the beginning and the end of the fertile window of each cycle. Cervical mucus reflects the beginning, peak, and end of the time of fertility. And cervical position can help to confirm high estrogen with an open and high position, and when switched to a closed position as fertility closes. LH surge confirms high estrogen levels prior to ovulation, and your BBT shift can confirm ovulation has taken place and can help you predict when your period's going to come. So let's take a closer look at this chart. Cervical mucus is our primary biomarker we use to determine daily fertility. In the pre-ovulatory phase, we might not be fertile, or there may be fertile days due to seeing cervical mucus along with menstruation during light days or heading right into mucus observations. So you might skip that pre-ovulatory G dry days altogether, and this tends to occur more in shorter cycles. But remember, even if you have regular cycles, you could have a short cycle every once in a while. Menstruation can be fertile in the case of early ovulation and if follicular development launches early. So, fertile e mucus can overlap with menstruation, enabling sperm's survival. So, you need to monitor cervical fluid on those light days of your period, and whatever you see should be charted, both your period and e qualities if you see them. Whenever you're on your period, the G mucus barrier dissolves to allow for bleeding to occur, and that means that in that time period, there is no barrier to sperm until menstruation is over, and the G mucus again fills the cervix that's stimulated by the residual progesterone from the previous cycle. Therefore, this can be a vulnerable time for infections as well. So, your ovulatory phase begins at your POC, your point of change, and both EL and ES mucus are both fertile because they both can enable sperm's survival. E mucus is alkaline and neutralizes the acidic environment of the vagina. EL mucus filters abnormal or slow moving sperm, and ES mucus in the cervix enables sperm survival and transport precisely when the egg is available. ES mucus conveys sperm through the cervical canal within 3 to 10 minutes. Peak day plus 3 is a really important rule that you need to be charting when looking at your cervical mucus. So, this rule adds a buffer period around your fertile window to ensure the method works up to 99.6% effective. So, this count of 3 is used for these main reasons: 1, to confirm ovulation has occurred and to allow the ovulated egg to dissolve, and 2, to allow the vagina to revert back to a acidic pH once mucus has dried up, and allowing for the G mucus plug to block the cervix to prevent sperm and bacteria from getting through. If mucus with ES quality, so that stretchy, clear lubricative, is noticed during the count of 3 days after peak day, that day should be relabeled as the new peak day, and the count of 3 would begin all over again. Any uncertainty in observations should be charted as the most fertile sign, so ES, and be considered as a fertile day. Remember that ES mucus is the last day of any of those ES qualities: clear, stretchy, lubricative, or slippery and watery. And it might not be the day with the most mucus seen, but it's the last day of any ES qualities. Ovulation occurs on or within 3 days on either side of peak day. So you can see your peak day down below. Ovulation can occur on any one of those days from -3 all the way up to +3. And once that egg is ovulated, it only lasts for 12 to 24 hours. Now, there is a phenomenon if you hyperovulate where you could actually release another egg during that 12 to 24 hour window. And that's actually how fraternal twins are conceived. So peak plus 3 accounts for all those things. So when should you actually use a count of 3 days? You're going to use it on that last day of any ES mucus, so your peak day. You can use it on any single day of ES mucus if your patterns are not clear or established in your post-ovulatory phase. If you have 3 or more EL mucus days in a row, you see any unusual bleeding, or you've missed a day of charting. Some longer cycles, like those with PCOS, can experience prolonged pre-ovulatory phases and can have start and stops in attempted fertility. So we can call these like fertile patches. These can be observed as EL or ES mucus before an actual establishment of the ovulatory phase. Therefore, all ES observations should be followed by a count of 3 days. Bleeding can obscure the observations and may appear in the pre-ovulatory phase, around ovulation, or before menses. Bleeding could represent insufficient unstable estrogen or progesterone levels, causing the uterine lining to shed. Days of spotting are considered fertile until an ovulatory pattern has been established. So if you commonly have a day of spotting prior to your period and have confirmed ovulation, that would be okay. Note that you don't have to use the +3 day count with yellow observations unless you observe ES or bleeding along with that confusing observation. If you think it may be E mucus, elevate that to the most fertile sign and then do a peak +3. So remember that yellow observations, when we are uncertain or confused, when we're first starting to chart, we're going to deem that day fertile, but we don't have to add the count unless you see other observations with it. So your post-ovulatory phase is the phase where you are no longer fertile. So this phase begins on the 4th day after peak day, so the day after peak +3, and here the egg is dissolved and the dense G mucus forms a barrier to keep sperm and bacteria out. Mucus dries up and those dry days can be observed due to progesterone. So your post-ovulatory phase is going to be the day after peak +3. So when you are using your multiple biomarkers to track your chart, whatever day allows for the extension of the fertile window is the one that you're going to use. Your post-ovulatory phase will also be confirmed by using your basal body temperature. So your BBT will rise in the post-ovulatory phase as well as during ovulation. So this will differ per person and can differ per cycle as well. And we look for 3 risen temperatures from your previous minus 6. So you can see on the chart how our temperatures rose on day 15, and the following temperatures are still raised. So we can go ahead and confirm ovulation because they are above the previous 6 temperatures that are darkened there. Now, progesterone can raise a little bit prior to ovulation, but we're not getting that max amount, which raises our temperature that much until after. So usually, once you get a raise in temperature, ovulation would have occurred the previous day. But again, you need to match this up with your cervical mucus, your LH test strips, and if you're using cervical position. Remember that your fertile window will extend to the farthest extension until you can confirm you are definitely in your post-ovulatory phase. Again, you might choose to use LH test strips to help confirm your fertile window, and this can help you to identify the approaching ovulation in confusing cycles. Remember that LH tests cannot identify the beginning of the fertile window, so they can't identify your POC, likely you'll be fertile before you actually get that positive, and they also can't identify if you do actually end up ovulating. Remember to always use a count of 4 days with a positive LH test, and therefore your infertile phase will begin on day 5 after LH plus 4. And let's say that your temperature rose that 6th day after LH. You wouldn't deem yourself in that post-ovulatory phase until you have 3 raised temperatures. On the 4th raised temperature, then you can say you're in your post-ovulatory phase. Here's another what-if scenario. So we are going to follow whichever one lasts longer. Peak plus 3, LH plus 4, or 3 risen basal body temperatures. So you can see on the chart how we had a positive LH on that 2nd day of ES mucus. So we put our count of 4. And then we have a peak day on the last day of ES mucus with our count of 3, which extends past the LH plus 4. And then our 3 risen basal body temperatures are on the 3 days following peak day. So we wouldn't deem ourselves in our post-ovulatory phase and no longer fertile until we are on that 4th day after peak day. So here's a little recap of our fertility awareness rules. So you are fertile on any day you observe cervical mucus, EL or ES, and sometimes yellow. You're potentially fertile during pre-ovulatory phase until you check mucus and confirm if dry. You're also potentially fertile if you notice abnormal bleeding or yellow days. And of course, you are fertile during your fertile window, and you need to cross-check mucus and BBT and maybe LH test strips or cervical position. Other considerations and things that might confuse your mucus observations are arousal fluid or seminal fluid. Arousal fluid is a wet vaginal secretion produced by the glands at the base of the vagina at the time of sexual stimulation, both physical or mental. These fluid qualities can help make intercourse comfortable, but one difference you might notice between this fluid and cervical mucus is that the arousal fluid dissipates quickly. So if you rub your fingers together, it should dry up fairly quickly. It can remain a couple of hours, but usually it's not a problem with distinguishing it from cervical mucus. Seminal fluid can be more confusing because it resembles ES mucus, so it can remain for a couple days if your partner ejaculates inside of you. Sometimes you might feel this after intercourse for the next day or two, and to help limit the amount that you're actually feeling, you can try Kegel exercises. So you want to do this within 20 minutes of intercourse, and this can help to push out seminal fluid and cervical mucus from the vagina, clarifying mucus observations for later. Note that that method is not a birth control method, so if you were to push out whatever's in you, it's not going to reduce the chance of getting pregnant because your cervical mucus will rapidly filter sperm and transport it to your cervical crypts. And if you're not in your fertile window and that cervical mucus is not there, it's just going to die within minutes to hours. So the days that you choose to have intercourse, you're going to be charting this on your chart just to keep track of everything. So you can either use an eye or you can use a heart. So this is a quick overview of the given rules to avoid pregnancy using your cervical mucus. So during the first cycle, you would avoid all genital contact. During your second cycle charted, you would have intercourse during the evenings of alternative dry days. And on your third cycle, you can include any time after during that post-ovulatory phase. And on your fourth cycle charted and beyond, you can include light days at the end of your period. So during your first cycle of charting, we recommend you avoid all genital contact. So this instruction gives the opportunity to become familiar with your biomarkers and signs of ovulation and establish cycle patterns. Introducing seminal fluid in this cycle would add confusion to your cervical mucus observations and delay learning. The cycle pattern and time of fertility are not yet known, so to avoid pregnancy, you should avoid all genital contact because if fertile mucus is present, you might become pregnant as pre-ejaculate fluid might contain sperm. So this really gives you the opportunity to become familiar with your biomarkers and your signs of ovulation to better establish your cycle pattern. So once you have charted one full cycle using your new charting techniques, you can start to have intercourse during this second cycle. Now, what you choose to do is up to you, but this is just what our recommendation is. And this allows for you to get the most efficacy out of the FAMM method. So during your cycle charting instructions, you can have intercourse during the evening of alternative dry days in the pre-ovulatory phase and the post-ovulatory phase. So a dry day is going to be no mucus and a dry sensation. Alternative allows for a full day of the elimination of seminal fluid and then a second full day to determine dryness and infertility. Evening allows a full day for mucus to be brought forward by gravity and the motion of the day. So this is going to be your first cycle in which you might have intercourse, and therefore you have to distinguish between your biomarkers and seminal fluid. So you will have charted a full cycle, identified peak +3, and begun to see your pattern establish. This allows you to have more evaluation and gives you more confidence in identifying your infertile phases of the cycle and make those distinctions between biomarkers and other fluids. So let's take a look at the chart there. You could have intercourse on the evenings of alternative dry days, and this starts the second dry day after your period. So you see how after our period, we have a dry day and then we skip. So that would be the first time that we could actually have intercourse. And then we wait for another dry day and skip because we're doing alternatives. And then also the evening helps to bring that mucus forward. So that's why we were doing it in the evening. And then also if you do have intercourse, that allows for any ejaculatory fluid that's left over from the previous day to be expelled. And then we hit our fertile window there. So you see our POC, and then we have our peak day. We add a count of 3 days, and then we wait a day, and then we can have intercourse on that day. We skip one intercourse, and then all the way down. So if you're charting and you have no clear POC, peak day, or cycle pattern establishing, you should stay on these second cycle instructions before moving to your third cycle instructions. Once you are on cycle 3 instructions, you could start to include any time during your post-ovulatory phase. So once you have confirmed your peak day and your basal body temperature and anything else that you might be using, then you are free to go during that time. So by the third cycle, biomarkers and cycle patterns are more clearly determined, and all dry days in the post-ovulatory phase, so that fourth day after peak day, become available because ovulation has occurred and the egg is no longer viable. So you're not just going to randomly ovulate during that time. And therefore, there would be no possibility of pregnancy during the remainder of this cycle. And remember that we are waiting till fourth day after peak day because we want to make sure that ovulation has passed and the egg has dissolved. During our pre-ovulatory phase, we are still using the evening of alternative dry days because this is high pregnancy risk area and we are still trying to learn our cervical mucus and what we are actually seeing. So we would have intercourse the second dry day after your period, skip one, and then we could have one there. And then we enter our POC, our peak days a few days later. We wait till our count of 3, and on that fourth day following peak day, then we are free to go. And you might be thinking why we can't have intercourse during menstruation, and that is because just when you're first starting to chart, you might have difficulties visualizing the mucus if you have any mucus mixed with your period. So for now, we're just going to take those out. So once you feel confident in your charting, you can move to fourth cycle instructions and you can have intercourse during the light days of your period. Some women have shorter cycles, so we need to make sure that we don't see any mucus during that time as well. So on the chart, you could have intercourse on that light day of menstruation and then follow the evening of alternative dry days rule. And then following our confirmation of ovulation, you can do it at any time. Remember that if you see any ES mucus or bleeding in that post-ovulatory time, we need to follow this with a count of 3 days of possible fertility if you have not confirmed ovulation with your BBT. So here's a little example of when you could have intercourse based on your cervical mucus observations. So for the first cycle you are charting, you could have none. And that is again your call, but those are the rules for the FEMM cervical mucus method. And then for cycle 2, you could include evenings of alternative dry days. So that would be days 7, 9, 21, 23, 25, 27, and 29. For cycle 3, you could also include any time after your fertile window, so during your post-ovulatory phase, which would start on day 20. So you could use day 20 to day 30, and then also the evenings of alternative dry days in the first part of your cycle, so day 7 and 9. And then for fourth cycle instructions, you could also include those light days of menstruation, given you see no cervical mucus. So you could include day 5 as well. Here's some examples of confusing cycles. So if you have a cycle looking like this first one there with just a bit of EL mucus patches, so this could be due to puberty or after pregnancy, your breastfeeding, or your post-pill. If you're comfortable with charting, you could use those second cycle instructions doing the evening of alternative dry days. So you could have intercourse on day 2, 4, 6, 9, 14, 16, 18, 26, 28, 30, 32, and 34. Because remember that we have to do evenings of alternative dry days. So when you're doing day 9, for example, we have to wait until day 8 because that's our first dry day, and then our second dry day would be day 9. Once we see EL mucus again on day 11 and 12, we have to wait again for a full dry day, and then the next day we could. The middle chart there kind of resembles what it's like with an irregular long cycle, like for example, PCOS, and this is giving us an uncertain POC. So we are not really sure where our point of change is, and this is due to delayed ovulation. So FSH might repeatedly attempt to launch a cycle, and your ovulation is being pushed. Sometimes this is due to stress, illness, and again, PCOS. So we would still do the evenings of alternative dry days. So you could have intercourse on day 7, day 9, 14, 16, 20, 22. And then we have our peak day on day 27. So we wait our count of 3 days. And then for third cycle instructions, we could have intercourse during any time after that we've confirmed ovulation with our peak day and our basal body temperature. So if you have bleeding near ovulation, that could be ovulation spotting or an unstable endometrium due to rapid hormone fluctuations. And whenever we see bleeding mid-cycle, we do use a count of 3 days for that reason. So during this cycle, you could have intercourse during days 7, 9, 11, and then anytime after in that post-ovulatory phase. Premenstrual ES mucus observations may be cervical responses due to estrogen and not fertile mucus. So due to the fall of progesterone prior to your period. So you might notice a little bit of ES mucus right before your period, and that can be normal. And if you've already confirmed ovulation using your cervical mucus and your basal body temperature, that would not be fertile for you, so you can just ignore that. So before you rely on this method as your main contraceptive, you need to ask yourself these questions and make sure you feel confident. So are you making and recording your observations accurately every single day? Can you confidently identify ovulation, so your POC, peak day, and your basal body temperature shift? Can you identify your true menstruation, that 12 to 14 days-ish after ovulation? And you understand that it's possible to have bleeding that is not your period. Because remember, your period is always going to follow ovulation. If you get a bleed that has not followed ovulation, this could be a withdrawal bleed or a breakthrough bleed. Can you confidently identify fertile and infertile days? Are you comfortable with Kegels to help eliminate seminal fluid post-intercourse? Can you tell the difference between cervical mucus and arousal fluid? And do you have an overall sense of confidence interpreting your menstrual cycle events? That was it for this lesson. Watch this video as many times as you need to become comfortable and choose what is best for you. You don't have to follow these rules to a T, but they are recommendations to get the most efficacy out of this method. We do recommend charting 3 full cycles until you use this method as your main contraceptive. Perhaps this can be longer depending on if you feel confident or not. If you're coming off post-birth control, it could take longer as well. As always, if you have any questions, pop them in the FAMWISE community and we'll go through them together. If you're feeling confused on how to use your biomarkers to confirm that ovulation has taken place and you're now in your post-ovulatory phase, look back on the demo where we do the full cycle charting together. That's it for this lesson. I will catch you in the next one where we talk all about planning for a pregnancy.